Welcome to another video. This video includes 10 nursing practice questions to teach you how to master the NCLEX. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. A nurse is caring for a client with Guillain-Barré syndrome. For what essential care related to rehabilitation should the nurse prepare the client? Diminished visual acuity, increased muscular weakness, pronounced muscular atrophy, impairment in cognitive reasoning. The answer is diminished visual acuity. Rehabilitation needs for a client with Guillain-Barré syndrome focus on physical therapy and exercise for the lower extremities because of muscle weakness and discomfort. A client is placed on a ventilator. Because hyperventilation can occur when mechanical ventilation is used, the nurse should monitor the client for signs of hypoxia, hypercapnia, metabolic acidosis, respiratory alkalosis. The answer is respiratory alkalosis. Increased rate and depth of breathing results in excessive elimination of CO2, and respiratory alkalosis can result. On the third postpartum day, the nurse would expect the lochia to be rubra, serosa, alba, scant. The answer is rubra. This discharge occurs from delivery through the third day. There is dark red blood, placental debris, and clots. The nurse writes the following nursing diagnosis for a client in acute renal failure, impaired gas exchange related to decreased red blood cell production, increased levels of vitamin D, increased red blood cell production, decreased production of renin. The answer is decreased red blood cell production. Red blood cell production is impaired in renal failure owing to impaired erythropoietin production. This causes a decrease in the delivery of oxygen to the tissue and impairs gas exchange. Morphine sulfate 4 mg IV push every 2 hours as needed for chest pain was ordered for a client in the emergency room with severe chest pain. The nurse administering the morphine sulfate knows which of the following therapeutic actions is related to the morphine sulfate? Increased level of consciousness, increased rate and depth of respirations, increased peripheral vasodilation, increased perception of pain. The answer is increased peripheral vasodilation. Morphine sulfate causes peripheral vasodilation, which decreases afterload, producing a decrease in the myocardial workload. A female baby was born with talipes echinovarus. Her mother has requested that the nurse assigned to the baby come to her room to discuss the baby's condition. The nurse knows that the pediatrician has discussed the baby's condition with her mother and that an orthopedist has been consulted but has not yet seen the baby. What should the nurse do first? Call the orthopedist and request that he come to see the baby now. Question the mother and find out what the pediatrician has told her about the baby's condition. Tell the mother that this is not a serious condition. Tell the mother that this condition has been successfully treated with exercises, casts, and/or braces. The answer is question the mother and find out what the pediatrician has told her about the baby's condition. The nurse must first assess the knowledge of the parent before attempting any explanation. The nurse is admitting a client with folic acid deficiency anemia. Which of the following questions is most important for the nurse to ask the client? Do you take aspirin on a regular basis? Do you drink alcohol on a regular basis? Do you eat red meat? Have your stools been normal? The answer is, do you drink alcohol on a regular basis? Folic acid deficiency is strongly associated with alcohol abuse. Goal setting for a client with Meniere's disease should include which of the following? Frequent ambulation, prevention of a fall injury, consumption of 3 meals per day, prevention of infection. The answer is prevention of a fall injury. Vertigo resulting in balance problems is one of the most common manifestations of Meniere's disease. A 2-year-old boy fell out of bed and has a subdural hematoma. When his mother leaves him for the first time, you will expect the child to be comforted when he is held, cry, not notice that his mother has left, Withdraw and become listless. The answer is cry. This baby probably will cry, which should be prevented because it will increase his intracranial pressure. Asking the mother to wait until the baby is asleep may help. In healthcare settings, nurses must be familiar with primary, secondary, and tertiary levels of care. As a nurse in the community, which of the following interventions might be a primary prevention strategy? Crisis intervention with an intoxicated teenager whose mother just committed suicide. Referring a client who has been on a detoxification unit to a rehabilitation center. Teaching 5th grade children the harmful effects of substance abuse. Counseling a client with post-traumatic stress disorder. The answer is teaching 5th grade children the harmful effects of substance abuse. Reducing the incidence of disease through education supports primary prevention. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.